before we start anything, I would like to introduce the president first. Now I'm at a little bit of a small speech and Sunday I started. And Major Maharina and Sana Matwasu.
Yo, that's Kofi. Observe, where you're in a Huaquaba. The Yamia say, what dear bedroom pensui, the Shafi, I say. You didn't say, you be cutting any answer my December. December crowd, you do say, almost halfway through. The Yamia Sepa this year has been very, very successful. The this year, and so say, baby, Yamiadum, the 2 year completion. Thankfully, this is going to be a last event I could see the year. The kind of na your modern boy, your book who you can see there once in Yamisha, especially the love we have among ourselves, the commitment we have among ourselves, day in and day out, whenever we call upon each other, the selfless dedication, your sacrifice, Yamisha, you say the years ahead, also very, very, very interesting. Now, I am focusing on what we are about to learn. You Dr. Pius, Dr. George, the more previously, I think last year, this year, so for mobile educating and on diabetes. And hope you say, pay attention. Nah, hit 40, you're clear to me. Bibi ene na yesu ya dia shebutum na yesu ya dedicate your family ne your namfo no na hopefully ebe boyen na your health so hurt me tumpon ti we dem man yetintin bia me sa ja makofi na odi jumai di ashase kofi edase.
Okay, we shall find that. So the procedures kind and then just some cases. You know, Sebi or my being or topica, your name, or mother boy, na how many young Tia, how you didn't have one share between the boy and help you. Into the my make us up before I send a metro as no. The Yamidi, ever chassis na I'm a Jumadi dinner and Bibia call. Come up. Harry, who did you have about my
Observe for your mompire, the chassis, a bonfire on your major or bar neon concluding. A young popon me a bank here, that was step with the bisham, say, Pompa. Samburia, a bisham, a bishia about our help. Nidikan, that was say, or enquire with their chain, only a health provider. Eddie, oh wow, or more dear in your room. The sir say, Asafa womb, my answer. I won't so to me a share with us. The sir say, by my understanding, yes, to me the best. A ray tree, ne wakakai to me the abobra. That was to say, one to me Makai and Sasso, or don't bow the Kai and Sasso. No, ma meeting is so the bass dream. Successfully am I. That was the sweaty and piable. Oh, yes, Christ, amen.
Amen. All right. And see, wait here. I was there for Yen Chapra. You will introduce it. Yeah, Pius, Dr. Pius Owusu Afriyie. In AY 73. Now, when we deal with first presentation, I pre-diabetes. I didn't say how agree. Today, Dr. Major Amon Odiako.
Thank you very much. I appreciate it. And thank all of you for making it to this webinar. We were hoping for more participation, but I'm sure that after we are done, it's going to go worldwide and a lot of people are going to benefit from it too. So we thank you all for, coming to join us today. Today's topic is very important. It's very, very crucial in our lives today because all of our foods are quote unquote messed up, for lack of a better word. So it's important that, we take very good care of ourselves. And one thing I always say is the human body is like, it's like a vehicle. You buy it brand new, devoid of any type of malfunction, and if you don't take care of it properly as you should, routine maintenance and things of that sort, before you realize it's breaking down beyond repairs, and you will have to spend a lot of money in order to repair it, and sometimes you may not even get it back. That same philosophy is true for the human body. A lot of things can go wrong and you don't even know that it's going wrong. So if you don't have the wisdom to check on it every now and then to see what's going on and act on it, one day you may have to suffer some medical event that may be detrimental or deleterious to your life. Prediabetes is one of those conditions that they can go unnoticed. You can have prediabetes and not know that you're living with this condition. But before I get into it, I'd like to introduce myself a little bit more. I'm Pius, you already know. I'm a practicing physician assistant. I went to Howard University. I graduated in 2009, and I furthered my education at University of Lynchburg in Virginia. That's where I had my doctorate. I've been practicing for the past 15 years, and in my practice, prediabetes is very, very common. I see it all the time, and I tell patients, hey, this is the situation, and this is what you need to do. So let's get into prediabetes, brothers and sisters, and see what it really is, okay? All right. So let's get to some definitions here. Prediabetes, what is the definition? Is when your blood sugar levels is higher than normal, but it's not enough to classify it as diabetes. So in a nutshell, you don't have normal blood glucose, but you don't have it enough for a clinician to say, oh, you have diabetes. So you are constantly living with some abnormal, or I would say impaired glucose. And that being a constant state of your situation, you may not experience anything, and you just continue to live with that. Your blood sugar is always abnormal, but nothing is happening, and so you don't feel anything, so you don't see anything. Why is that important? Prediabetes, why is it important? What's the significance of it? It is because it has the potential to lead you into diabetes. It can turn into full-blown diabetes where you will suffer medical complications from. So back in the day, we had this school of thought where prediabetes only encompassed 3 organs, which were the pancreas, the liver, and the muscle. And we called that the triumvirate. In regards to the pancreas, it's an organ in our body that is responsible for producing insulin. In the pancreas, you have your beta cells and you have your alpha cells. Your beta cells are responsible for producing insulin, and your alpha cell is responsible for producing glucagon. Insulin is what regulates blood sugar. It takes blood sugar away from the blood for your tissues to be able to utilize it. Alpha cells produce glucagon. Glucagon puts sugar into your body. So if you are if you're hungry, or if you are, say, hypoglycemic, you don't have enough sugar, that hormone glucagon puts sugar into your system for your body to utilize it. So in prediabetes, you have a dysfunction in the pancreas because of these two cells, because these two cells are problematic. In the liver, you have overproduction of glucose. Blood sugar is being overproduced. You have excess storage of glycogen. When you eat, excess of the sugar turns into what we call glycogen. It's a type of carbohydrate that the liver stores. In the medical state, in the clinical state of prediabetes, your glucose production is elevated and your glycogen storage is also elevated. In regards to the muscle, you have a dysfunction in the muscle's ability to uptake glucose. And your muscles are, or your muscle cells, or your cells in general, are resistant to insulin production. So remember I said that insulin helps bring glucose from the blood, but if your cells are resistant to insulin, that process is impaired. You are not able to. So in the triumvirate, you have beta cell dysfunction or alpha cell problem. There's a problem in the pancreas, there's a problem with the liver, and there's a problem with muscles being able to uptake glucose, or you have insulin resistance. I worked with a very fine endocrinologist, Dr. Luis Rivera, and he introduced a research to me by another well-renowned endocrinologist called Ralph DeFronzo. DeFronzo has done extensive research in diabetes and metabolism. And in his research, he came up with the ominous octet, that the old school of thought about diabetes being only, thought of as a problem in those three bodily organs, the liver, the pancreas, and the muscle. There's a lot more. DeFronzo postulated that there's a lot more to prediabetes. There are more factors that contribute to prediabetes other than those three. So it was from the triumvirate to the ominous octet, from 3 to 8. So in that 8, he classified the first one as insulin resistance, decreased insulin production, increased glucagon secretion, impaired hepatic glucose production, neurotransmitter dysfunction, lipotoxicity and lipolysis, gut hormone changes, and renal absorption of glucose. I'm going to explain this, but I've already explained the first three, which is the insulin resistance, and then also the decreased insulin production. Now, according to DeFronzo, those people that have insulin resistance, or those that have prediabetes, about 80%, some of them, 80% of their beta cells have been destroyed. So they're walking around with impaired glucose, but they only have just about 20% of capacity to produce insulin. And on top of that, they have muscle problem or insulin resistance. They're not able to utilize the little glucose, the little insulin that they are producing. Okay, so increased glucagon secretion, that we already talked about that, hepatic. Okay, so DeFronzo added more, which is the neurotransmitter. So it's not just those organs, but now we have brain problem. You have a brain issue when you have brain signals that are impaired. You're not able to control your hunger. You're not able to control your appetite. You're unable to say you're full, so you eat a lot more. So you have brain signals that tell your body that you're hungry, and then you also have brain signals that tell you that you're full. When you have a dysregulation in this mechanism, then you don't know that you're full and you're eating a lot more than you should. We also have the lipolysis and lipotoxicity classification, which is you pretty much produce some fatty acids that block your body's ability to utilize insulin. And that produces insulin resistance. So before, we just knew that the muscles were not working, but according to Delfonso, there's a lot more in that has everything to do with how you metabolize lipids. So fatty acids that you produce, they have ability to stop the insulin from being able to properly take glucose away from the body. There's also intestinal hormone changes. You know, there is a hormone called incretin inside your gut, that if you have impairment of this hormone causes you to feel full, right? And also regulates glucose. If you have impairment in this type of hormone, then obviously you're not going to know when you're full. You're always peckish. You always want to eat more, and you are not able to regulate your blood glucose. So all of this going on, your blood sugar is constantly high. And there is renal absorption of glucose, and I want to dwell on this part because it's very weird how this happens. Typically, we all know the kidney as a organ that helps, you know, remove waste from the body. It absorbs a whole bunch of toxic substances and excreted as urine. But that's not the only thing that the kidney is for. The kidney maintains blood pressure. It also, you know, help regulate blood sugar. So typically, if your blood sugar is around, say, 180 or below in your body, the kidney has this mechanism whereby it takes the glucose from your body, but then it puts it back into your system. It is designed that way so that you don't lose energy. So it takes away excess glucose, but it has the ability to put it back. But in the state of prediabetes, it gets you're constantly more than what it can do. You know, you go beyond that threshold. So what happens is the kidney adapts that, oh, this guy's glucose is always high. So instead of it excreting it, it adapts it and puts excess glucose back into your system. And in that state, you are always constantly having impaired glucose. So you have so many different factors that is contributing to the state of prediabetes. And it's not just the triumvirate, which is pancreas, muscle, and the liver. Now you have brain involvement. Now you have kidney involvement. Now you have gut or intestinal involvement. So now we move on from the triumvirate to the octet. Now we are in the nonet. There's the gut microbiome. In your intestine, you have millions of flora, meaning microorganisms. There's a whole ecosystem of microorganisms that is designed to be there. And they help with metabolism, they help with digestion, but they also help with glucose regulation. Some of that is, you know, they produce some short-chain fatty acids to regulate appetite and the satiety hormones that I discussed. So if you have a disruption in this type of environment in your body, then obviously you're going to have disruption in your hormonal or your ability to metabolize and regulate glucose. Now, I want to talk about inflammation. The gut flora that I'm talking about now, they also modulate inflammation. What is inflammation? A lot of the the medical problems that we have generally, they all have underlying inflammatory process. Autoimmune disorders like, lupus, you name it, most diabetes, high blood pressure, they all have underlying inflammatory process. Arthritis is all inflammation. Most of these things are all inflammation. So diabetes or pre-diabetes comes down to one thing, which is inflammation. Now, this gut flora, this intestinal flora, one of the primary functions is to produce anti-inflammatory compounds that reduce this type of inflammation. And in so doing, it's able to regulate glucose or help with insulin sensitivity. When we say insulin sensitivity, it means that your body is able to really properly utilize insulin to be able to take glucose from the system to help with the organs and the tissue. Now let's talk about the risk factors for pre-diabetes. There's unchangeable ones and there's changeable ones. The changeable ones are age. Usually people over the age of 40, you're more at risk for pre-diabetes. If you have a family history where one of your parents or two of your parents have diabetes, you are more at risk for developing pre-diabetes. Your ethnicity matters a lot. You're African American, Hispanic, you're Native American, you're Asian American, you're more at risk for developing pre-diabetes. And there's also the changeable factors. All of these things, me and my colleague, Dr. George will go deeper into some of these things. So there's changeable ones, which is the weight. You can always change your weight. You can always burn some fat to promote insulin sensitivity so that you be able to utilize insulin to help with glucose regulation. You can change your diet, eat proper diet, not a lot of carbs, not a lot of sugars, so that your body is not overloaded with unnecessary carbohydrate or unnecessary sugar. Sedentary lifestyle, you can always change that and do something that you like, become active so that your muscles can get going and improve insulin sensitivity. What are the symptoms of prediabetes? Remember, we haven't classified this as diabetes. It's still a state whereby you're not normal, but you're not quite abnormal. You're sort of like in the limbo. So would you have symptoms? Well, some people don't have any symptoms at all. They just walk around without, clueless about what's happening. They don't have any symptoms. So if they don't go and get checked for any reason, then they just keep on going. But some people, according to DeFranzo, people that have prediabetes, they're divided into three. The upper tertile, most of them have lost about 70 to 80%. So by the time we are diagnosing you of prediabetes, you're already done. And in those cohort, 50% of them will progress into type 2 diabetes. So if you're starting to have symptoms of fatigue, if you're starting to have symptom of polydipsia, which is increased thirst, or polyuria, which is urinating frequently, or having, other symptoms such as blurry vision, you probably are on that end of the spectrum whereby more needs to be done. Now, why do you get these symptoms? You get polydipsia because your kidney is trying to regulate your glucose. It is taking away excess glucose from your body, and water is always binding to glucose, so it depletes your body of water. So you always feel thirsty. Now you're peeing more, you're urinating more, and then that in of itself will deplete your volume and make you become thirsty. And so you peeing. And then you have blurry vision. That is other complication that Dr. George will discuss further.
said, it's hard to say.
Okay. Now, how do you diagnose prediabetes? There are many ways to classify prediabetes or diagnose. It's usually through blood test. Usually you fast overnight. After 8 hours, then we do a blood test. If it's above a certain value, then we know that you are pre-diabetic. If it's within a certain range, we know that you're normal. I won't go over those values. Dr. George will go through those values with you. We also do A1C tests. We call it the hemoglobin A1C. This test is very important because it measures how well you've been controlling your blood sugar over the past 3 months. So it is your hemoglobin cell, that is a hemoglobin molecule that is bonded with sugar. So we measure that to see if you have been controlling your blood sugar as it should be in the span of 3 months. And then we also have the oral glucose tolerance test, which we give you something to drink, and then after 2 hours we check the value to see if it falls in a certain range. Now, prediabetes, how do you why is it important to you? I'm trying to get into this thing. Yeah, why is it important, and why should you care? You should care because prediabetes leads to heart disease. It leads to diabetes. It leads to stroke. When I was in school, I did my internal medicine primary care rotation with Dr. Barnes. Dr. Barnes was a cardiologist, internist, and he was always saying that diabetes and hypertension is diffuse vascular disease. Basically, if you have this condition, you have inflammation all throughout the body. Your vessels are all problematic. You have inflammation going through your arterial walls into your capillaries. Everywhere is sort of sore. In diabetes, you have, I want to go back to the previous screen, please. Yeah. In diabetes, you have microvascular complications, macrovascular complications. The microvascular complications leads to things like, retinopathy, which makes you have blurred vision. You can have nephropathy, which is like kidney failure, and you can obviously develop diabetes, but then you can also lead to stroke. The macro ones are sort of peripheral artery disease, whereby you have claudication, limited blood flow going into your extremities, and then you also have numbness and tingling sensations because your hemoglobin is just pretty much caked with sugar. So you're not able to effectively use the hemoglobin molecule as it should be. So most of your tissues are suffering. Your nerve cells are suffering. Your blood vessels are suffering. All of these things, cause serious medical events in the future if it's not taken care of. The only way to prevent this is early detection, so that you can, reverse in some cases, begin treatment early so that you don't develop the end stage complications of these things. How do you prevent it? Healthy eating, fruits, vegetables, whole grains, avoid refined foods and sugars and refined carbohydrates. Physical activity, you have to aim for at least 30 minutes of exercise 3 to 4 days a week. Weight management. The more you exercise, the more your tissues become very sensitive to insulin. So those people in that category that can do some reversal, if you exercise, you can truly reverse pre-diabetic state. So if your tissues are becoming more sensitive to insulin, you are producing some insulin. So you will be able to utilize the glucose that is in your system more effectively by just exercises. Some people have actually been diagnosed with prediabetes and have actually embarked on serious aerobic exercise and no longer diagnosed as pre-diabetics, and their blood sugars are now constantly normal. The screen is locked. Okay, there we go. All right, so healthy living, stay active, balanced diet, do regular checkups. Just like motor vehicle, if you do regular checkups, you're able to pick on things that are being that are malfunctioning. You can change them. It reduces cost. It's the same principle for the body. If you are able to, stay on top of your health maintenance, going to the clinic when you should, doing exercise, eating healthy, you are going to avoid a lot of these unnecessary medical events that can happen if you happen to have prediabetes or diabetes. Myths and facts about prediabetes. So is it only overweight people that get prediabetes? No, not necessarily. Skinny people like myself can get prediabetes. Remember, there are certain risk factors. If I have a parent that have diabetes, I have the risk to developing diabetes or prediabetes. Age 40 plus, yes, definitely weight is part of it, but it's not only overweight people. Skinny people can get prediabetes as well. Prediabetes always turn into diabetes. Well, with lifestyle modification, you can reverse. There are some people that will stay in that condition of prediabetes and not develop into diabetes. Remember, in prediabetes, you have beta cell dysfunction, meaning that you're not producing enough insulin, but you are producing some insulin. It's not all lost. You're still producing some insulin, but you also have other factors that come to play. So if you have good tissue sensitivity, you're exercising, you're doing what you're supposed to do, and you have good tissue sensitivity, you are able to utilize the insulin that you're producing. If you are eating healthy, you're not overloading your system, whereby your pancreas have to eject significant amount of insulin to match what you have put inside your body. So if you do these things, you are actually putting your body in better shape. So yes, some situations it can be reversed. Some people, if they've lost enough beta cell, unfortunately they will develop into prediabetes, but there are treatments. Now, prediabetes is two schools of thought. Some people think that if you have prediabetes, there's nothing called prediabetes. You already have diabetes. And if you do have prediabetes, then we need to start treatment right away. We need to put you on some medication that can help regulate your blood sugar. Some others still, for now, some others still say prediabetes. And so, it is what it is. It's a state, it's a condition whereby you're not classified as diabetic, but you're not also normal. So you have to make sure that within that state, you can try to reverse as much as possible so that you don't end up with those complications, because those complications are not quite reversible. If you have retinopathy, if you have nephropathy, peripheral vascular disease, and other things, you have caused damage already. Now you can stop it from progressing, but you cannot reverse some of the damages that have been done. This is my last, so I will introduce Dr. George to continue. Dr. George has more details with the numbers, and I'm sure you'll be interested in seeing the numbers and maybe going out to check to see what your numbers are, to see if you're pre-diabetic and if you need to make some changes. So without further ado, Dr. George, you can take over from here. Thank you.
All right, Dr. George, you're mute. All right, whilst we're waiting for Dr. George, I would like to say thank you to Dr. Pius for the insightful presentation. And so after our second presentation, we will follow by Q&A session. So please take notes of any questions you have. All right, so Dr. George, please take the stage.
Okay, thank you, Dr. Pius, for this insightful presentation. I know by now we've all understood some of the basic knowledge on prediabetes. So I will continue on diabetes. So my name is Dr. George Amoateng, and little information about me. I went to school in University of North Carolina, Charlotte. Then after that, I went to University of Maryland. Then I went to medical school in Spartan Health Science University. And I specialize in primary care. For the past few years, I've been specializing in functional medicine or holistic health. And we go to the root of every disease. Like, that's how we make we don't just give medications, we tackle the roots. So with this, I'll go ahead with this presentation. Okay, so diabetes is a very common disease, and it's very important that we all understood it well. So diabetes is a chronic medical condition that occur when our body cannot produce insulin, or our body cannot effectively use it. So insulin is just the hormones that metabolize blood sugar. So anytime we eat, insulin will come, and then we take the sugar to the cells of the body. So when we eat too much sugar or too much starch, then as a result of defense system or defense mechanism, the body or the cells will tell insulin that, hey, we don't need too much sugar, like keep bringing us sugar. So the body will just, in order for the cells to save the body, they will just resist the insulin. So the insulin will be piling up, but then the body cannot use the sugar that is bringing. So there are different types of diabetes, but for this purpose of this presentation, we will talk about diabetes type 1 and 2. But we have, for informational purposes, we have other types like gestational diabetes, which occurs during pregnancy. And we also have diabetes insipidus, which is just due to problem with ADH hormone. So, but for the purpose of this, diabetes type 2 is something that we can do something about it, that is so easily to reverse. So we will talk about that a lot. So type 1 diabetes is autoimmune condition where the immune system will attack the insulin producing cells in the pancreas. So just like Dr. Pius said, the pancreas produces insulin, right? So if you have type 1 diabetes, your body will fight against, your own body will fight against the pancreas producing the insulin. So you cannot produce the insulin at all. So this situation is hard to help. Like, you don't have insulin, so we just have to give you insulin, artificial insulin. It's typically diagnosed in childhood and early adulthood. Type 2 diabetes occurs when the body becomes resistant. So like I was explaining earlier, when you eat, insulin will come and take all your sugars to the cells. And the cells, when the cells have enough, they will be storing it. But then when they keep storing it, their cups become full, then they will send a signal to insulin that, hey, we don't need you. You are giving us extra sugars that we don't need. And insulin will also say, well, it's not my fault. My people keep eating, so I need to come. So, but then if we keep eating the sugar, insulin have no choice than keep increasing. And when they keep increasing, they now turn into fat, right? And then that is where the body becomes resistant, so the sugar will also be piling up. So that is how type 2 diabetes comes about. So these are some fascinating facts about diabetes. Yeah. So about 38 million Americans have diabetes currently. About 96 million have pre-diabetes, which most of the time, about 80% of the time, it leads to diabetes. And the relative cost of diabetes is about 20% of all healthcare costs. And we have almost 5,000 new cases every single day. And we have about 295 daily amputations secondary to diabetes. And about 137 new kidney failure cases every day. So worldwide, we have about 800 million people with diabetes, right? And these numbers are even far worse because these are like the known ones, right? So, and the population of America, like about 80% of everybody, 80% of the population have some sort or some kind of insulin resistant problems like pre-diabetes. So the likelihood that if we are 12 people here, at least 80%, 8 of us will have some kind of insulin resistance. So this is very common and we have to take charge of it. So, as Dr. Pius mentioned earlier, some of the risk factors are here. So we have obesity. When we are fat, the likelihood of getting diabetes is very high. As we age, like now, all AYs people are hitting 40 now, so we are all at risk. And unhealthy diets. So the main culprit here is starchy food, like our own favorite watches and the fufus and all those, and processed food with high sugar, like these are the things that we should be aware of. Lack of physical activities is also a problem. Family history and stress. Stress have serious impact on blood sugar. Anytime we are stressed, there is a hormone called cortisol, which will increase our blood sugar, even if when we are not eating sugar. And obviously, pre-diabetes will also lead to diabetes. So now, what causes blood sugar to rise? So carbohydrates, which, as we see from the screen, like the rice, our favorite banku, fufu, wache, kaleole, gari, all those things. Yeah, those are the main. Like this even causes more blood sugar than sugar itself. And the next one is sugar, and we have high fructose corn syrup, which I will explain later. So fructose is dangerous. Fructose is equal to, like, another name for high fructose could be like liver poison, right? Because liver is the only organ in the body that metabolizes fructose. And then starch. So if we are doing all these, which these are kind of inevitable, like this is what we eat, and this is somehow who we are as people. We love this. So, and they lead to diabetes. So I will explain more how we can minimize this. So I would like to elaborate more on the composition of sugar. Sugar composed of glucose and fructose, right? So it's actually 50% glucose and 50% fructose. So anytime you are eating sugar, whether it's white sugar, sodas, juice, you are eating 50% glucose and 50% fructose. So the problem with the fructose, right? You see, with the glucose, when you eat sugar, insulin comes in and is taking the glucose to all the cells in the body from head to toe. All the cells in the body are getting their share of the glucose. But the fructose, right, if you keep eating sugar, right, the fructose part, which is 50%, a lot, it goes straight to the liver, right? So imagine your whole body receiving the glucose and the liver, few pounds in weight, receiving the fructose. So it becomes problematic. So that is how somebody may not be drinking alcohol, but then if you be eating fructose, then the liver gets overwhelmed and then become fatty. That's how we get non-alcoholic fatty liver disease, right? So it used to be like back in the day when people were eating good, like only alcoholics will have this kind of problem, will have fatty liver diseases. But these days, younger people who don't drink, right? So you tell yourself, hey, I don't want no problems. I don't drink alcohol, but then I like sugar, or I like fufu. Yeah, if you like fufu, you like fructose. If you like wache, you like fructose, and all this can lead to fatty liver disease. And any liver disease is dangerous. I mean, it can kill you. Like it's just dangerous. So our next one will be starch. So starch, maybe like this will be your first time hearing it, but starch contains more sugar than sugar itself, right? The composition of starch is like it's glucose plus glucose plus, it's like 100 rings of glucose, which is sugar, right? So if you eat, like, I know, like this food on the screen, it's everybody's favorite, right? Right. If you eat this food right now, so if you eat your fufu or your wache, right, there is a enzyme, salivary amylase, to come and then to break down this glucose, right? It breaks it down, then they all rush to your body. So in actual sense, if you eat this kind of food, you are consuming more sugar than somebody eating just sugar, right? So the only thing that makes sugar more dangerous is the fructose part, is because it's starch has more sugar, but at least the whole body part from head to toe is receiving the glucose, so at least it has places to go. But then if you eat just sugar, is 50% going to the body parts and 50% going to the liver. So yeah, so if you ever think that I've reduced my sugar intake drastically, but I'm still into my food, my refined carbohydrates, my flour foods and stuff, it becomes a problem. Like you're actually eating more sugar than sugar itself. Okay, so I will elaborate more on insulin resistance, which in other words is prediabetes. So like I said before, anytime we eat, especially processed food, refined carbohydrates, starchy foods, insulin will come into play, and then we'll take all the food that we eat, the starch, which is the glucose, then it takes it to the cells, right? But then if we keep eating sugar and starches and carbohydrates, the cells uses it, and the excess one, it will store it. So after a while, the storage barrel in the body becomes full, and then it will send a signal to insulin that, hey bro, I don't need all these sugars that you are bringing, all these glucose you are bringing the body, we don't need it anymore. But then glucose will also go and blame it too. The glucose will blame it on you, saying, hey, Kofi has been eating so much sugar, I can't help it. I need to come into play. I need to take it to you, right? But then if we don't listen, then the cells say, okay, in order to save myself, I'll be resistant to you. So the cells become resistant to the insulin. Then there's insulin also trying to protect itself. We say, okay, let me just turn into fat. Let me just pile up, and it piles up, and it turns into fat. Then eventually it leads to metabolic syndrome, right? Where you're going to have increased cholesterol, hypertension, cardiovascular disease, and all those things. It will come into play because the body did not listen to the signals, the warning signals. So that is how we get insulin resistance. So these are some numbers, indicators that we should be aware of. So they've come up with some numbers that are considered to be normal. Like if you're fasting, the normal numbers that you're supposed to have is about 70 to 99 milligram per deciliter. Then after 30 minutes, that is where you reach your peak. They expect you to have about 170 to 200. Then 2-3 hours, the body has utilized some of these things, and we expect it to come around 120 to 140. Then if you are insulin resistant, fasting, we expect you to have about 100 to 125. It's normal. Then after 30 minutes, they expect you to have 200 to 230. Then 2 to 3 hours, 141 to 160. Then if you have diabetes itself, if you are fasting, it's going to be more than 126. After 30 minutes, around 230. Then 2-3 hours of fasting is going to be about 200. Right? So, but all these numbers in reality is based on, these numbers are, it needs to be tightened up because these numbers are based on us eating our regular foods, junk foods, and all those things. Junk food, processed sugars, and stuff. So, I have. Let me see if I can share this. I think I can. But I have this graph, right? Is it? Yeah. So if you look at the top graph, if we keep eating junk food, right, this is what happened. Like the glucose will go up, and then insulin will come, and then the glucose go down. Insulin. Anytime you eat, glucose go up, insulin come into play, then go down. So if you keep having these roller coaster kind of graph, right, you will have that is how you feel fatigue, mood swings, and all those things, right? But then if we eat whole foods, green leafy vegetables, right, if we eat well, like no junk food, this is how it's going to be. The second graph, like the glucose, the insulin will just move up just a little bit, and then it will be like stabilized throughout, right? So if we eat right, it's going to be like insulin will be like stable, and we wouldn't need we're not going to feel fatigue or tired. We wouldn't need energy drinks and all those kind of stuff. So if you are eating right and eating plant-based whole foods, low carb, high fat diets, this is how the numbers gonna look. Okay, yeah. So the optimal numbers that we should be looking at. So just in case somebody is here is just of healthy living or diet, your fasting number should be around 80 to 90. After 30 minutes, it's going to be about 90 to 110. Like anytime you eat and you're eating right food, right? If the whole day you've been eating salads, fruit, vegetables and stuff, right? Your numbers, it doesn't have to go down and up like that. It's going to be like stable throughout. So even after 30 minutes, you still have 90 to 110. 2-3 hours, you have about 80 to 90. So this is how it's going to end. If your numbers are like this, no way that you're going to get insulin resistance or prediabetes. We can all try our best. So we come to diagnosis, right? There are several methods that we use to diagnose, and we have fasting blood sugar test, where we make you fast, then you come in and we take a sample of your blood, we test, and we expect the normal number to be about 70 to 99. Then if you're insulin resistant, get about 100 to 125 diabetes. But then for them to diagnose you with diabetes, like we have to do it on 2 separate tests, and they will have to be like similar numbers. Then we take the average and then diagnose you. Then the best test that we know in the medical world is hemoglobin A1C test, where this test will, like Dr. Pius said, will track your sugar intake for the past 3 months, and the normal will be when you are less than 5.7 pre-diabetes or insulin resistant, it'll be about 5.7 to 6.4, and when you are diabetic, you have like 6.5 and over. Okay. Then we also have random blood sugar tests, where like you are not fasting, just randomly you come in and then we take your blood test. You should have about over 100, over 200. But then for us to diagnose you with this kind of test, you should be having the symptoms, which is like classic symptoms like frequent urination, excessive thirst, unexplained weight loss. So if you have 200 but you don't have these symptoms, we cannot really diagnose you. It should be like it's mutually exclusive. Okay, so the optimal test, right? Like if you have a good doctor, right, and especially if you are insulin resistant, they should be measuring insulin instead of glucose, and this is why. So the body is very smart, and it keeps regulating sugar, like, because very, very, very low sugar is bad for the body, and very high sugar is also bad for the body. So always glucose is a tightly controlled variable. So let's say you are insulin resistant, and it takes years, it can take decades for you to develop type 2 diabetes. So let's say you have insulin resistant, and year 1, we measure your glucose, and it's at this level, right? Always the insulin is there to control that sugar, right? We come to year 5, because the insulin is still controlling the glucose, insulin will be doubling. You are insulin resistant, right? So the insulin will be doubling, and it's still helping out the glucose a little bit. So your glucose will be the same. Then you come to year 10, insulin has about tripled, but then your glucose is the same. So by the time we come to year 15 to year 20, then we diagnose you with type 2 diabetes, right? But then if we were measuring the glucose alone, you'd be like 20 years or 15 years late. So in your mind, you'd be like, I've been eating the same kind of food, so how come for years they are now diagnosing me with type 2 diabetes? So it's just because they were measuring the wrong things, right? So the body mechanism, the system that breaks down, that deals with glucose, like the carbohydrate machine and all those things, like, it's pretty tough, and it can protect you for years. Then one day you become carbohydrate intolerant, and the machine breaks down, and now all of a sudden you have type 2 diabetes. So you can think of it as, let's say it's like right now it's 20 degrees outside, right? But you have all your jackets, you have your thermals on, so it's 20 degrees outside, but then inside you are about 70 degrees with all those jackets, right? So if we come in and we measure your temperature and we say, oh, you are 70, you're good, right? But then the outside temperature will still be 20, right? So just because you have controlled the temperature inside, so that's what goes on in the body. Like the body is controlling the brain, your whole defense mechanism is regulating that sugar. So if we don't measure that insulin, right, if we don't measure the temperature outside, we're going to give a false results. So that's why we should, like, especially if you know you are insulin resistant, like every year, at least if you do your lab works, tell your doctor, right? So if your insulin has been doubling, tripling, and you are still pre-diabetes, you still have those numbers, you are actually at danger. So you should start like eating whole foods, green leafy vegetables, because if you get to type 2 diabetes, right, it might be too late for you. Okay, so treatments for diabetes, like as you can see, I've put question mark there. So we are made to believe that treatments, like medications, can do something for us, but in reality, medications cannot do anything, especially with type 2 diabetes. Like if you have type 1 diabetes, of course, the pancreas cannot produce the insulin at all, right? So we have to give you artificial insulin, right? So temporary medications may look like metformin and other medications will increase your sensitivity to insulin for a while, right? So what these medications will do is, like Dr. Pius talked about microvascular diseases, which are the complications of diabetes. Like, so some of the microvascular disease, like the blindness, tingling, numbness, because of the nerves, right, that these sugars affect. So the medications can help slow the progression to getting those microvascular diseases. But then if we keep taking them and keep taking insulin, right, it will actually lead to bigger problems like the metabolic syndromes, right? Like it can lead to cardiovascular diseases, can lead to hypertension, can lead to high cholesterol, and all those things. So if you have type 2 diabetes, the good news is you can reverse it completely. Like this is not even you can reverse it with confidence with food, right? So I'm going to talk about the optimal treatment for diabetes, right? So how did we get there? We got there through the food that we were eating, right? We got diabetes because we were eating sugars, a lot of fufu, a lot of wachi, a lot of browns, a lot of sodas, juice. Like there is nothing like juice. Juice is still sugar. Juice is still like soda. There is nothing good about juice. So if you want juice, right, you can eat the fruit. This is because if you drink juice or soda, the glucose goes straight to the bloodstream. But then if you eat the fruit, even though it may have the same amount of content, at least it doesn't have the chemicals and the preservatives, right? And also, once you put the food in your mouth, your whole body, once you are chewing the food, your whole body is ready for you. The body knows that, okay, I'm eating, so now the whole system will be in place for you. So it will take a time to absorb. Don't go straight like soda or juice. Don't go straight to the bloodstream. So it's good to, instead of drinking apple juice, you eat the apple. Watermelon juice, just eat it, right? Because if you put if you make your own fruit, let's say you have a very good juicer, at least that one is better than the processed juice that is on the market. Yeah, because if you make your own juice within 3 days, if you don't drink it, what happens? It oxidizes and then it actually becomes bad and you cannot. But then if you go to the market and get your apple juice, it can stay there for months, nothing will happen. Why? Because of chemicals. So if we eat low carb diets, like low plant-based carbohydrate diets, then eliminate sugar, right? And do low carb diet, high fat diet. That's the keto, right? If you do this, like I have had so many clients that once we go this way, even within 3 months, your numbers will, like, let's say I have people who came in with 8 point something, 9 point something, in 6 months, they'll be 5 point something, like normal, without medication. Some people come with medications. I'm like, okay, let's take you off the medication, right? You just have to be cautious. We're taking you out of medication, but just do your daily test, right? Just in case, right? You're not doing something right. But then if you follow your diet, that low carb diet, high fat diet, keto way, you can reverse diabetes completely in months. Then other things that will help also intermittent fasting, because like the graph I show you, anytime you eat, there'll be like a roller coaster. Sugar goes up, down, insulin come in, then it goes down, then you eat again, it goes up, then insulin come in, it goes down, up, down, up, down, up, down. So if in a day, sometimes we can eat like a big meal, but that big meal should only contain green leafy vegetables, right? And meat like grass-fed meat. You have to always know the source of your food. Yeah, if like, especially if you know you are diabetic or pre-diabetic, like issue, it's gonna be expensive. These foods are expensive. Like you go to Whole Foods, like, because organic food at Whole Food versus organic food at Walmart or Aldi is sometimes completely different, right? So you get verified whole organic food, green leafy vegetables, and you eat once or twice. Or if you eat one and it's devoid of carbs, right, insulin will go up just a little tiny bit, and then will stabilize throughout, right? So, but then if you do the junk food, it's always up and down, up and down, up and down, then your problem continues. So to help with the reversal, if you eat low carb, high fat diet, and we're talking about good fat, like olive oils, eggs. Like egg is very good, but then you have to know the source. It has to be like pasture raised eggs, right? Because depending on the kind of egg, instead of omega-3s, you'll be eating omega-6, and they'll be adding up to your cholesterol. But then if you eat pasture raised organic eggs, you can even eat 6 a day, and your omega-3s will be increasing, right? So depending on where you get your eggs or the kind of eggs, yeah. So people may say egg will increase your cholesterol, but that is when we're talking about the regular eggs on the market. Yep. So the next one will be reducing stress. So, and stress can come from anywhere. Yeah. So if you have diabetes and you want to help yourself, you don't fight with your wife, you go to work. Like if you're working, let your work be a hobby, like the work that you like, so there'll be no stress on you. Because anytime we are stressed for whatever reason, cortisol increases, and increased cortisol means increased blood sugar. So let's say you are not eating sugar at all, but then you are stressed. It's still like eating sugar because cortisol will come and increase with its own pathway, increases your sugar level. So another one would be like gentle exercise. If we do gentle exercise, what happens is we'll be using fat instead of glucose. Gentle exercise will help decrease the amount of sugar in the system. Because if we do intensive exercise, first of all, intensive exercise will increase your stress, and the stress will bring cortisol, and then the problems continue. So, but then you always have to make sure gentle exercise every day, because only muscle rest. If you are at rest, muscle at rest requires insulin. So if you are not moving and you're always sitting down, always sleeping, your body will call for more insulin and the problem continue. So gentle exercise provides enough oxygen. So with the oxidative pathway you increases your you decreases your sugar level with gentle exercise. So if you are diabetic and you are really serious, or insulin resistant, and you are really serious that I want to get rid of it, right? Your food should be as colorful as the one on this screen. Yeah. So whole food, plant-based, organic, green leafy vegetables. Like if you eat cauliflowers, broccoli, it has so much fiber, so much water content. You're actually gonna eat less. Insulin will not rise, and within months, diabetes be out of your way. So it's very important. So these are the impacts of healthy living. Healthy living, will not only help with diabetes only, it helps with almost every kind of condition. So it's going to reduce blood sugar spikes, it's going to improve insulin sensitivity, and also healthy living like weight management also going to help reverse or prevent type 2 diabetes. Okay, so these are some of the chronic complications of diabetes. So if we don't do anything about diabetes, or we are not disciplined enough to tackle it, like diabetes is like the foundation of all diseases. So from heart, cardiovascular diseases, heart attack, strokes, atherosclerosis, nerve damage, blindness, kidney failure, like almost all organs in the body, we're gonna have a problem, right? Hearing impairment, dementia, Alzheimer's, depression. Like diabetes is the king of all diseases. So we don't wanna get there. So if you're lucky enough and you're not there, you continue to do what you're doing so you don't get there. But then if you're pre-diabetic, by the time we diagnose you with pre-diabetic, you're actually closer, very closer to getting diabetes. And once you are pre-diabetic, just love your life enough to go with the colorful green leafy vegetables. So these are some of the actions, like from the previous slides, we can do to after 40, like most of us are, these are the things that we can do to have optimal health. So we should always, at least every year, do our labs, right? And sometimes you have to do your own research, or like some of the medical doctors you see may not do all the necessary tests, right? All the necessary market, because sometimes insurance will not cover, so they'll be measuring the wrong things. Then just make sure you know, like I taught you about insulin. You have to measure your insulin. You have to measure your thyroid, like autoimmune diseases markers. You have to measure them to make sure everything is all right. You monitor your blood sugar, especially if you're insulin resistant. You do your daily or every other day test. So active living, like we said, is gonna help reverse diabetes or insulin resistance. So overall, we should do all these things to, like, for overall wellness, because like health is just like, health is worth, so we should invest some of our money in our health. Once we have good health, we can enjoy our money, we can enjoy our families, and we can enjoy our loved ones. So call to action. So I'm not saying this to discourage us from eating our favorite food. Like me myself here, all those foods are my favorites. I love my banku, I love my wache, my kalawole, and all those things. But if I look at my loves, depending on the directions, right, at least 1 week I can say, okay, let me eat all these colorful foods. Then after that, I treat myself with some serious wache, right? So you can kind of, depending on where you are, right, you can kind of be balancing it. But once if you are diagnosed or you are insulin resistance and your numbers keep getting higher, that one there has to be mostly green leafy vegetables, mostly no sedentary lifestyle. You got to keep moving, stretching, exercising, not running but walking. Like stationary bike, you can be on it. At least once you're in that state, at least 30 minutes a day, kind of gentle exercise. Then any kind of stress, you make sure you deal with your stress and you will be good to go. Okay, so let's take charge of our health today for a better tomorrow, so we can enjoy all the money all the stocks, the cryptocurrencies. Yeah, when you save your crypto till age 50, 60, 70, you have time to enjoy. So let's take charge of our health. And thank you for listening, and I hope we gain good knowledge from this. So at this point, if you have questions, Dr. Pius and I would be glad to answer.
All right. Thank you, Dr. George, for the comprehensive presentation. So now we will move to Q&A sessions. And if you have any questions for Dr. George, Dr. Pius, please, you can go ahead and unmute yourself and then ask the question. So I'm going to wait maybe a few seconds here, and if I'm not hearing anyone talking, I'll go ahead and ask some few questions whilst we wait for people to put together their questions. So I'll give myself about a few seconds here. But if you do have any questions, please, you can unmute yourself or raise up your hand and I can call you and, All right. Okay, so whilst you're waiting, I would proceed with my first question. And, I would like to know what are some of the common misconceptions about pre-diabetes and how we can, as a community, combat these myths, right? So, Dr. Pius, if you can help us with that.
Thank you. So one of the common misconceptions about prediabetes is that it's not serious, which in reality, prediabetes is a critical health condition because it predisposes you to developing type 2 diabetes. Another misconception is that, only overweight people tend to have prediabetes. Well, weight is a significant risk factor, all right, but it is not just that. There are people with normal body types that can develop prediabetes and progress into type 2 diabetes. There's another misconception. Once you have prediabetes, it means you will definitely develop diabetes. Is this true? The reality is, prediabetes does not guarantee you that you will develop diabetes. Now, with lifestyle modifications, healthy diet, as Dr. George has elaborated on, lifestyle modifications, healthy diet, gentle exercise, making your foods very colorful, you can actually reverse that condition. And another one is, it's only adults that do get prediabetes, because we mentioned that age 40 is a risk factor. Yes, it's true, but we see teenagers and other age groups that are showing signs of impaired blood glucose. So yes. And the second part of your question was, how do we as a community combat these situation? Well, we have to have education and awareness, and this is what we are doing. We're doing exactly that. We have to organize webinars and workshops and things of that nature, and make sure that people are educated on it. People are aware that these conditions do exist, and in fact, you may not have any symptoms, but it's important that you do routine health maintenance so that you can detect these things early. Screening programs. You can do mobile health clinics, telehealth options, things that you can increase access, having policy advocacy where if we can engage people of authority to give us the necessary resources to engage the community by doing these types of screenings. At churches, my church, they do blood drive, they do these types of health screenings. So it's imperative that we design, such events and activities around our community so that we can increase the access for people to be able to see what their state of affairs is. If you do health screenings in a church and they participate, you get blood drawn, they see that, oh, your blood glucose was very high. And so follow up with your primary care so that, it can be monitored and, you can do this ABCD to reduce it. Support groups, people that are at risk. If you identify people that are at risk, you can put them all together, and in the same vein, more education, more access to community resources, exposing that there is this condition there that people need to know, and these are the treatment modalities that you can use to reverse. I hope I answered your question.
Oh yes, you did. And the beauty about your answer is that you actually tackle a lot of questions that I have related to or tied to this question. So thank you very much. That was very helpful. Anybody has questions before we keep going? I mean, any questions at all? You have any?
Yes. Maybe Sabi.
Okay.
Me akwa.
Oh yeah, sure. Go ahead. Wait.
Na see. See amo okay say aduane ben kura biuta. Yes, and could you say Dr. George? With Dr. George question you come on. Again, you bit me there substitute sugar. What the infant say, ye jay bonkudi. Ye jay a starchy. Where's the ultra coffee kakra, ultra tea kakra? You say, yes, it be or why sweetener. And no crepa says, sweetening. The DNA, sugar element, DNA. And also, yi kakra, harmful. The question you can.
General, what's the question? Can you have another one?
Wait to my
okay. Okay, so you see, also technology except when it comes to food, right? Yeah, when alter your foods are all these complications about. But once you alter food, it's not food anymore. It becomes a product, right? And you put that product in your system, health effects. Most of the time, you're right away, you might be thinking, so it's okay. So, yeah, there is nothing like sweetener or diet Coke or diet something. All those things doesn't help. They're all full of chemicals, right? Anything that is not nature made, it's a chemical and it's not going to help in any way. You must well eat your sugar. Like instead of maybe putting a sweetener in something, like you have your oath and you want, instead of sugar, maybe you can put apples, blueberries, some kind of fruits, right? Yeah, but sweetener and all those substitutes, they are all chemicals, and eventually it's not good. It's going to cause a lot of harm. Yeah, most of the time, you can see diabetes here from 40s, we're at risk. It all started from what we did in our 20s and our teens, right? Just that the body is so good in fighting all these things. So, you drew 40s in the right? But then it started in our teens. It started when we were younger, when we were eating processed junk, refined starches and stuff into them. Yeah. So eventually, all those substitutes are not good.
All right, Doctor Edasi. With the doctor, I'm from Akuntren. Let me say, advance when it comes to technology. In the medicine. But there, some I can say, these wearables, the watch, you see. What are some of the ways I need to use to say even AI? AI, buy a Jehovah's and AI, see. What can we use these technologies and AI to prevent diabetes? To say a bit me impact. If as me I'm watching, can I even use these watches to help? How do I even implement AIE and now all these technologies around us to help prevent diabetes? Is it even possible?
Well, like
And
when
now
it comes to
what movie be? To say, young man, how try to miss out. Is it possible?
Yep. The only thing all those things can do, and it's a but the more you're aware, say something is going on in your body, right then, like or Apple Watch, then abnormal heart rate and all those things. But eventually, especially when it comes to diabetes, yeah, no AI will help. It's discipline. It's straight food. It's like what you put in your body determines the outcome. Like no AI of any sort can ever help. Like, yeah. So,
But you don't care. Oh, sorry. No, just worry.
oh yeah, yeah. Like in a nutshell, AI cannot help when it comes to like you advancing in your diabetes and stuff. Yeah, it's just
Okay. All right. Dr. George, that's it. Dr. Pius, I'm from Ross, Canada. A boy, and they say, well, you're not boy, you're feeding your proper medication. No, so now, yes, prevention, the idea. Now, the end, Drobia, Kibano, Nashasi, and you and a phone, but me a boy drew the camera, not to say. One of the young pop to diabetes, right? I free diabetes, okay, it's part of a trinity, but you be sour. And I will be said, what would you have?
What run it? What modern more your exercise away. But we enter into the condition of pre-diabetes now. Some medical professionals will start treatment. Remember, in my slides, I mentioned one of the causes in the triumvirate, which was the 3, one of the causes was liver, right? So there is increased hepatic glucose and increased storage of glycogen. One of the medications that is started in prediabetes is metformin. Its mechanism of action is to decrease the hepatic glucose production so that your liver will not put sugar into your system. So it suppresses your liver's ability to put that glycogen back into your system. That is right now what we are using to treat prediabetes. But what draw obedi and no exercise, because these things are reversible. So if you are diligent enough on yourself, if you have that discipline, you can actually, do your routine exercise, routine health maintenance, eat properly, and get good numbers for yourself and live, healthily after.
Thank you, Dr. Adasi. Pacho,
Wait a
one question or remember. Okay, all right, sorry.
Me twa coffee question so Pius. Dr. Pius, Mr. Could there be a situation would be a pre-diabetic or timia or reverse it? Now I say about pre-diabetic. And I will reverse here. Now and one no. We're okay, we are good.
No. Once you've shown the tendency to have impaired glucose now, it means that that's all reverse your conditioner. That's we'll go back to your old eating habits now. The same mechanism can start again, whereby you would have insulin resistance, whereby you're putting a lot of sugar, your liver is putting a lot of sugar back into your system. You can come back to that state again. But you continue to live that lifestyle now, you probably will not have to suffer the consequences of chronic and constant elevated blood sugar.
Okay.
Okay, It's what the understanding I'm getting is you should that new lifestyle should become your lifestyle now going forward.
Yes, I mean,
Okay.
no, they never stopped eating those foods. And no mudi yedi cool. Omutumre any domo any hama and no omudi di from when they were children now so omudi cool until they aged well. But we are eating processed foods, just like George said. Yes, age 40 is a risk factor, but why? Because we started 20 years ago. You're free. You was mini cereal and milk. You had a Fruit Loops, any conflicts. I mean, maybe some people know was nobody, but maybe let me call a diner hall. You see, I had the idea you eat those processed foods because it's readily available in the shelves in your pantry. Into Woodia, we came to this country over 20 years ago. So what decided these processed foods over 20 years ago? Now, when it starts to show up, it's because you've been doing it for a long time. And I feel a unity, just like George was saying. But say we eat proper foods all the time. Now we are very active all the time. Chances are you are not going to have to deal with state of prediabetes or diabetes.
Doctor, that's it. But Obu will be a person of this floor is open because there will be two questions back up on yeah, sorry.
Look, say Mitiasia, and she say, Benfane say, Missoyano, Pabia, minum tea, Namidi, menum coffee, Namidi, Ebia, Nescafe creamer, and I say, Bia, Italian sweet milk again. Namano. Now, say, within the day, no, midi, Midi, to us, and I say, Midi banku to us, no anything green Libya. Now, let's say a twasso like week after week. What are the implications?
Yeah, like if that's your routine, is pretty terrible. Eventually you're going to develop, if you're not pre-diabetic yet, eventually you're gonna get there, because like your morning is full of sugar, whether it's creamer or all those creamer besides the sugar content is have chemicals, right?
Okay.
Yeah, we also go to starch like from the slice, starch bankuno more sugar crossing sugar now would right into if it continues and it continues then you eventually get there. And so the only proven way the green leafy vegetables, right, then now fufu ni bankuno I once in a while right if for now not to me like the thing is something is better something small is better than nothing. So sure if you eat banku 5 days a week no for a start between 2 days a week, then you incorporate the other days with the green leafy vegetables. And we have many ways of like even when you can go to YouTube like how to make green leafy vegetables, how to make real good food that is very good. Some nice recipes that you can come up with that it's not going to be like punishment, but you actually enjoy eating these kinds of food. Yeah, so banku and tea routine. Tea, if it's herbal tea with not even honey, just the tea itself, you're on a good path. But if you have to put creamer in your tea, in your coffee, and all those things. Like just a small, tiny action like that, once the insulin, arise it, right? Meanwhile, that creamer and sugar, then you could do banku crana at least. Say, why? At least you enjoy yourself. Why? Tiny creamer, your insulin goes up, then so it's better second be fast panel rather than maybe good food. Like if for now you're not disciplined enough, at least do back to the crowd, then eat it once a day. And so at least your insulin level rises just one time, right? Instead of the roller coaster kind of, So less frequent meals, will be the key.
And traditionally, people of West Africa, our foods are heavily tilted towards carbohydrates. We can try and substitute some of these carbohydrates with, proper carbohydrates, like there's a white rice, for instance, right? You can eat brown rice instead of the white rice. You can adjust if it's hard for you to quickly move from white to brown. You can mix the two. And another thing is the portion size. Nobody's stopping you from eating your banku, but it's more of the portion, because the amount of carbohydrate that you put in your body will cause your pancreas to secrete insulin to match that. When you do that kind of overload, you are effectively stressing your pancreas until eventually, you lose some capacity of pancreas. Until no one say it's either you don't have enough insulin, or you have insulin resistance, which is type 2 diabetes. Until you can control your portion that you eat, and you can also make some substitutions. You can get more of wheat, legumes, those unpolished carbohydrates, which are long chain carbohydrates. So it takes the body much longer to break it down into individual glucose. When that is happening, your pancreas is also adjusting itself in how much insulin it puts out. So you convert that long chain carbohydrate into simple glucose slowly. So your insulin is also being released slowly. And that's what Dr. George said, is steady. So you have to eat complex carbohydrates that the body can break down slowly, so that your insulin production is also, insulin release is also matching that type of process. So it will be very, very steady. Instead, so I could eat unpolished grains, heavy rice, large bottle of juice, that immediately when you put it in your body, there's a lot of sugar. So what the pancreas needs to do is to eject enough insulin to match it. That's overload all the time. After a while, it loses that beta cell activity. It breaks down. So you have to eat unpolished carbohydrates, and you have to limit your portions of carbohydrates.
That's fine. Questions in the vibrator. So, Catherine, we bring back. Mr. Mubu, how person be said you mean and son of the back off. Come question every day, and they say, Doctor, what's a
more question?
Victor, more every day. Yeah, questions no.
I think so of late, if you listen to the news, there has been a craze for Wegovy, Ozempic, and all those kind of, drugs to reduce weight. But, especially maybe I'm on Ghana for a new lifestyle a lot of people are moving into us. Meaning say Ozempic needles started as a treatment for diabetes and all those stuff. What are the side effects? And meaning say I online well now he has come to a crossroad. You are going a doctor, yes, one man and what are the side effects of some of these, drugs now banned? Because now people are using it a lot to lose weight, to treat diabetes and all that. What are the side effects, and is it advisable? Because very soon, anywhere in the ever your doctors who are not physical. So we are borderline, and some of these are things that a doctor need to suggest it to you. But when you have the full knowledge, then you can be able to know whether to, proceed with that or not.
Okay.
Thank you.
Very good question, Victor. Yeah, so some of the main side effects are nausea, vomiting, and delayed gastric emptying. See, there's another one called gastroparesis. The mechanism of action for that particular is one, to delay food from your stomach, so it slows down digestion, right? It slows down digestion, just like I just mentioned right now, that you eat complex carbohydrates and your body takes time to break it down. So this medication is actually helping slow digestion such that you don't actually overload your system with insulin. And then also it promotes satiety, like you feel full very quickly. So your portions are decreased. You're not eating as much because you have a delayed gastric emptying. Your stomach is slowing it down, so you don't eat as much. In a sense, no, your total calorie intake is decreased. But so when you're more of nausea and vomiting, that's it. It's not going away, then you may have to, back out of that medication, because there is something called gastroparesis, whereby you basically paralyzed your stomach. Then you're not able to pass food, and you will not be able to digest, and you will continue to lose weight and become very, very emaciated. And in fact, there was a case like that. So those are some of the serious side effects of the gastroparesis and nausea and vomiting.
Thank you, Doc. You did it. That's fine. But you'll be how did back on question. Our time yeah train the young for back over dog. Yeah, no kakra, ni jia, sakakra. Me dream answer, and some so idea. Na diabetes ana be Rebecca Soki and Sacrano carbohydrate. But what about whiskey? Single malt favorite number one. Whiskey you see the wheat na papa single malt. How does that affect diabetes and pre-diabetes?
Okay, so yeah. Alcohol, if you drink alcohol, it's mostly you're talking about liver problems, right? So alcohol and fructose, the same, right? So it's more of liver problems, but eventually, if you are drinking alcohol, it also affects other processes in the body. So eventually, it's not going to contribute any good thing to your body, right? So, not necessarily say the more your diabetes, but it won't help it, right? And if you are pre-diabetic and your liver is not functioning well, right? Eventually, it's not going to help, right? Because the liver not also have a pathway or diabetes control, right? Yeah, so if you messed up your liver, you're not helping your diabetes as well. it's better to drink in moderation if you cannot stop. But then the whiskey type there, it's better to stay away because the liver is a small organ in the body compared to the whole body. When the whole body is able to take glucose and other stuff, when only the liver is working to control your alcohol. At the same time, you are eating sugar, which are the fructose, also coming to the liver. Then that one is like, it's more like a suicide. Because liver problems are very dangerous. It can kill you like in a short time. Yeah. So moderation, but not whiskey credit, no moderation. Just stop.
Hey, yo, I'm not going to look you.
Okay, that's how you are saying.
I'm saying it's for no. You for now. I'm not no. And I think be at the body be unnecessary at the papa. Me who are there? Me board there at the phone.
But anyway, I mean, it's confusing when you're not cheap. Don't drink alcohol.
Wait, this is what I so much you second for more time not promotion as much.
I know, right?
Yeah, but
one question. Until young family say, your normal beer, and then the Guinness in the soil.
Alcohol, and once it's alcohol, it's targeting the liver. And trust me, you don't want to get liver disease. Like people who get liver disease, it's easy to die from it. Like I said, in moderation, like some people have done research that in moderation, like it depends, like a glass of beer, or like for instance, like the darker beers is better than the lighter beers, right? So if small glass like this a day or every other day, then you are good. But then if your glass is like a bottle, then you are in serious trouble.
Wow.
And remember, whatever we do, it comes because the body, God made it in such, it's so wonderful. The body will fight for you till it cannot fight anymore. So whatever you do in your youthful years, after like from 40, 50, 60, and it comes back. It's like it's a sweet revenge. It's karma. So yes, moderation.
Okay. Okay, no, yeah, the master. Yeah. With them, so we question back who be on from the last one, so because you do not actually. It be also there. I think say question that people say so be and by there is pretty much highlighting idea bubble soon. You be free. You kind of say need to swap up. Next week it be rather than fast but the star actually said he be and say symptoms mean doctor Pius Owusu be my pre-diabetes and no me knew a gina pia to say a buy only say no 2 months did the best pre-diabetes in the actually you and Dr. John the same thing 2 symptoms better. And Mr. Boy, and who said, you are pre-diabetes, you do diabetes one. It's just you drink cardiac pay and one from Chibi and doctor be major or boy. Those are the 2 questions that I have. Dr. Paul, now we are Dr. Jones, so at once.
Very important question. Yeah, well, question here very important. And so Obekaya misled, pre-diabetes typically have no clear symptoms. So my answer to that question is go and get checked out. That's the only answer I can give you. Now with diabetes, you have plenty of symptoms. But in regards to prediabetes, I will tell you, say, go and get checked because it goes unnoticed. You will not know, say, you have it. Very rare would you have other symptoms that are similar to diabetes. But once you reach there, you probably are diabetic. And, you know, my answer to that question is go and get checked.
Thank you, doctor.
So just like hypertension, right? There is no you might, but your body is fighting. If you have prediabetes, your body is fighting for you, and initial stages, your body is so strong at fighting for you, so there would not be symptoms, right? But then when it catches up to you, when the body system says, no, I cannot fight anymore, when the body breaks down, when the defense system breaks down, then it will be too late for you. So if you have excessive, like if you're drinking so much water, right, and you're peeing a lot, then you are losing weight, fatigue, then you know you are there. Like if you are pre-diabetic, if your numbers has been on pre-diabetic level, once you have these symptoms, you have diabetes. Like it's like a classic case of diabetes when you have the 3 P's, right? You're drinking, you feel like drinking a lot, then right away you're peeing, you keep peeing, then you keep eating, then you losing weight, unexplained weight loss. That one, you know, you are there. Whether you've done the test or not, you are there.
Kofi,
Thank you, doctor. That's it.
Kofi, really, Omodi will try to make a question. Inti, really, Dr. Pius, Dr. George, ni mobile advice say, if you are in the ecosuya system, per home device, bia, it the check blood sugar, bia, na bia, we are hospital, crying up so show how far. I don't know what advices are. I say, oh, dear, you know, so I doctor now, I check it.
Well, it's another interesting question. George said something that was very true. Is you can do your own due diligence, right? It's just like you can get blood pressure cuff and monitor your blood pressure. The same way with impaired blood glucose. Yes, you can get glucometer and overnight fasting in the morning. When you fasted overnight, you can check if you know the numbers you're looking for. Hopefully your glucometer is properly calibrated, and then if you check and you know is more than 126, then you know that you're diabetic. The other tests like A1C and oral glucose tolerance test, you can't do it at home. You probably need to be in a clinical setting to do that. But yes, with the glucometer, you can do a random blood glucose. And if you check your random blood glucose and is 200 and above, you're probably diabetic. If you check in the morning after fasting and is 126 and above, you're probably diabetic. So you can look up the numbers and check yourself and see. And then if you have some questions, then you can come to the clinic where we can assess further.
Thank you. Oh, no, okay, nice one.
Dr. George. Quotes now, number the my no. Did you know quotes no? Back Dr. George just say bread is one step away from sugar. And then one more bread is so na bread no sugar bread na now can na say bread beer.
Yeah. So
I mean also. I mean, you must question. And yeah, bro.
Okay. So like I said, like once we alter food, no, like it's no food anymore. It's a product. So bread, like refined carbohydrates, like so. Yeah, I'm talking about the regular bread on the market. Like even like the wheat bread is better than the white bread, and like there are some few bread on the market like Ezekiel bread, right? If you look at the ingredients, they got some fine ingredients, right? But then, like I said, they are all starchy, and starch is full of tons of sugar, tons of glucose. So eventually, the bread, once it gets into your mouth and the enzymes right away in your mouth, it starts turning to sugar. Right. So that's the one step away from sugar. Once it gets to your mouth, once you taste like, this is good, like, I have sugar, like just like that. So bread actually contains more sugar than white sugar. But unfortunately, they put white sugar in it as well, so it's double. Yeah.
Yeah, some more. But then came.
That's it. Amen. Amen, Kofi. Amen.
I was here for Renaissance. Yeah, you know, so I check her. Today, maybe don't be a seer. Be a to show up, be a bit be a the and I believe these valuable information and boy na to me and now then to me at no much enjoy each other and our families. Let me so far Dr. Pius and Dr. George Amoateng so Jamusu I say my dad no more if you no put together this presentation. Abma when said me fear the so me whiskey cry me try no dream and the sugar bread and wheat bread. So it's really damasi. Obi bia mutimi ba bia damasi. Major am president na say obi kakra the soso e dey wi. So they hurry come on.
Yo, Kofi. We there 24. We there. And me back say the omuti and then the catch Dr. Pius and Dr. George. Then the catch omuti and the opposite catch room will be out with me.
So my idea, presentation here very informative. It won't say a question, but I learned a lot, and I know it's been making impact in our individual lives. I'm for be a who pre-diabetic, and I said who are diabetic patient now. No, with me use information now. They are making change in their individual lives. See, they must say free information. I mean, normally you pay to get this type of information. So we are very, very, very grateful, and I appreciate the information provided. They must be.